So good morning everyone, I'm Dazzle J. Piedad. I'm a student nurse from Medical Colleges of Northern Philippines. I am here to perform the integumentary assessment of the patient. So first, I will introduce myself. I will identify my patient, then I will explain why we are doing the assessment. Also, I will answer any question of the patient. So good morning ma'am, I'm Dazzle J. Piedad. I'm a student nurse from Medical Colleges of Northern Philippines. May I know your name?
Precious Carla Sarita.
Your birthday?
July 25, 2000.
Okay, so we are doing this assessment to ensure that everything is normal. So if there's any abnormalities, we will take note on that to prevent further complications. So do you have any questions, ma'am? Okay, so if you have any questions, you can just approach me. So first, have the patient to take off her clothes and put some examination gowns. So unfortunately, we don't have the examination gowns. So we will just assess the patient's integumentary using her clothes. Now, we will start the assessment. So first, I will inspect the patient's skin for if there's any signs of discoloration. So ma'am, may I have your hands? So as I inspect, there's no signs of discoloration of the patient. So we have to know that yellowish color is jaundice. Then we have also cyanosis, erythema, and polar. So next is I will inspect the patient's skin if there's any signs of lesions, if there's any scratches, bruises. So now may I have your hands? So as I inspect, there's no signs of lesions, bruises, also there's no scratches. Now, we will assess for the patient's temperature using the back of our hand because it's more sensitive than our palms. And also, I will inspect and palpate for the patient's moisture and texture. If we have to know that moisture on the skin folds and axillary is normal. So, ma'am, may I touch your face? So as I assess the patient's temperature, it's all normal. So now I will inspect for the patient's skin turgor. So I will pinch under the clavicle. If it goes back to normal quickly, that's good. So the patient's skin turgor is good because it goes back to normal quickly. Next, I will palpate if there's any edema. Now, I have your feet. So I will palpate. So the patient doesn't have signs of edema, so that's good. Next is I will inspect the patient's nails if there's any clubbings, scoopings, also the angle, shape, and the size. There's signs of lesions. So as I inspect the patient's nails, there's no clubbings, also there's no scalpings, also there's the angle, the shape, the size is all good. Also there's no signs of lesion, so that's good. Inspect for the patient's nail for the texture, and also I will palpate for the capillary refill. So I will pinch the nails. If it goes back to normal quickly, that's good. That's normal. Grab your hand now. So the capillary refill of the patient is good. Also the texture is smooth, so that's good. Now, I will perform hand hygiene and put some gloves on. So, I will palpate for the patient's scalp and hair if there is any signs of lice, dandruff, and lesions. May I touch your head? So there's no signs of dandruff. Also, there's no signs of lice. Also, there's no signs of lesion on the scalp of the patient. So next, I will remove the gloves and dispose it. Then I will perform hand hygiene. So, So now we've done on the assessment of the integumentary. Now I will thank the patient for her cooperation. So thank you, ma'am, for your cooperation. So now that we've done, I will write the result of the patient's integumentary assessment.